Thank you. Good morning, everyone. Nice to meet you all virtually. I'm Janet Kilburn. I'm the Early Childhood Director at the Health Department, Maternal and Child Health Division, and I'm also the state lead for Help Me Grow Vermont. And we have developed a partnership here in Vermont to come together around a shared framework. And this partnership is between the Agency of Human Service, our health department, Help Me Grow Vermont, the New England Public Health Training Center, and the Vermont Public Health Association. And we were able to get a little bit of funding to hire a consultant, and these are her slides, Michelle Levy, who's wonderful. Kind of the mental health aspect of that. We put together this shared framework. So, and Emily is my partner in crime in everything to do with the Resiliency messaging project. She's done a lot of this work. So I'm going to start by just sharing the framework with you. And then there's some slides at the end. Emily, if you feel comfortable, you can jump in, or I'm happy to just plow through them as well. Okay, so next. So in Vermont, there was this real need to have a shared value about everybody has potential. All children need support to rise to their full potential, and it's better for all of our communities, right? We're all better off if the neighbors' children are thriving, and this is kind of a new frame, if you will, versus then kind of looking out for your own kids or ensuring that your own kids have what they need. So we're really trying to pull a diverse range of audiences, just, and folks in communities, civic leaders, people who aren't necessarily connected to early childhood together to come and have this shared value. And it's been made even more urgent through COVID. And here you see the classic silo photo. And I know you're all familiar with that work of trying to pull people together across all our different sectors: health, education, child welfare, family support, to really create that more integrated service system. Next. So the goals of our project were really to build this shared definition and understanding, to create a set of messages and common language that would really unite us. And we are a strengthening families state. We have flourishing communities, which is a near science effort, comes out of the state of Washington. It's neurodevelopmental, neurological I'm screwing up the acronym, ACEs and resiliency sciences, epigenetics, neuroscience, ACEs and resilience. It's really cool stuff. And we've been taking that around to communities, just sharing that information. And then we really wanted to engage key stakeholders. So everybody who has a stake in this messaging. Next. And here you just see this idea of creating awareness and familiarity, engaging, that can lead to advocacy. There is a lot of throwing around the word resilience and family resilience without a lot of clarity. What does that really mean when we boil it down? Next. So these ideas of moving towards this evolved definition, that value proposition, again, that is bigger than our individual efforts. And that we're really talking about a collective communal response here. So we're moving away from that kind of pull yourself up by your own bootstraps. It's all up to you. If there's something wrong with your kid, it's probably the parent's fault, right? That family bubble, deficit-based idea. It's a mental health issue. It's a universal concern, and it's really strengths-based, and it recognizes environmental, social, political, economic context and systems. And we're trying to create a shared imperative that we need to do this now, and it's it's all of our responsibility. Next. And here you see what we're up against. This is just a handful of all the different graphics, initiatives, programs, campaigns that we have in Vermont at this time. And it gets very confusing, you can think, for families. The 7 C's of resiliency. Here you see up in this corner, up in the upper left corner, strengthening families framework. But that is kind of a tricky framework for, it's a little bit academic, if you will. It's and so you just see that if we're looking at this from just the family's perspective, it can be overwhelming. Next. Okay, so we are talking here about a framework that we've developed. This is not a public health campaign, although we want to have a public health campaign. We need a little bit of more additional funding to do that, but really made a big effort over about the past 9 months to establish a shared language that everyone can agree on across a variety of providers and programs and stakeholders. And we're really trying to align and educate key folks that can take this out and message it. And then we would go to the next step of developing a real public health campaign with media, strategy, marketing, social media, etc. Next. So what is the definition of resilience? Here's our simple definition: capacity to thrive individually and collectively in the face of adversity. So we're trying to keep it strengths-based, really simple. And how are we working toward it? We're creating that integrated system where all Vermonters can find and utilize the resources they need to thrive. Again, that adversity, because we all face adversities and hardships. Okay, next. And why does it matter? Well, when we can all access what we need, right, we're all better off and our communities flourish. So if children and families and communities can give back, then we all benefit from that. Okay, next. So why are we prioritizing resilience development? And again, this is because it's very strengths-based. We're coming together in a collaborative way. We're trying to be forward-thinking and inclusive, but I think primarily we're really trying to use that strengthening families framework, and everybody has potential, right? But some people and some situations are lacking what they need to rise to that full potential. And we certainly want to make sure that that all children have the potential to develop fully. Okay. And so I was saying this we started this work before COVID hit. When COVID hit, we were kind of like, oh my gosh, everybody's so busy with the pandemic. Who wants to get together and have focus groups and meetings to talk about resilience? And then our governor started using the word resilience, and we realized this was a perfect opportunity to really talk about what was going on for everybody in Vermont. It's no longer just the people, in the next county that have problems. All of us were really struggling and could so much more easily realize we needed to all come together. So this was some resiliency messaging, and building a resilient Vermont, coming back to strengthen our recovery. So we moved forward, and we still had incredible engagement in our work to pull everyone together. Next. And so our consultant helped us to develop audience messages. So what does resilience mean to funders, to policymakers, to businesses and organizations, older Vermonters, and here parents? So I'll just read the parents one. The ability of children and families to be resilient, to thrive in the face of adversity, is more important than ever. You can build resilience by tapping into your unique strengths as a parent and taking advantage of resources that offer the additional skills and supports you need to make sure your child and family is safe, secure, and happy. So that, it's really okay to ask for help, and we all need a little extra help, certainly during COVID. So again, that strengths-based messaging, and that resources are there, and we want to help people connect to them. Okay. Next. I'm going really fast, but Emily, do you want to jump in?
Yeah, absolutely. All right, so I'm going to talk a little bit about what our deliverables have been thus far through the messaging project beyond just the incredible messaging that our consultant helped us create. So through that, we were able to bring basically all of the information in this slide deck here and put it in a PDF document that we were able to distribute out to organizations and people across the state that kind of holds all these tools in hopes that they're able to utilize this language and implement into their own frameworks and their own movements and programs. Next slide. We also have started a newsletter that goes out quarterly. We sent our first one out in October, and our second one is going to be going out in January, the beginning of January. So we're working on finalizing that right now. It's a really great opportunity for us as a team to kind of outreach to the entire state. I think we have about 180 people on our listserv who receive our newsletter every 4 months, 3 to 4 months. And in the newsletter, we're able to we hope to always be able to offer like a new tool or a new deliverable to them. In the first newsletter was the toolkit, and in the upcoming one, it's our technical assistance offering, which I'm going to talk about in a minute. We share a story of resilience building across the state, and so people can see where this is happening in our communities and the impact that that's having. We offer continued learning opportunities for people in this work and how to grow their understanding around resilience and all the different facets of it. And then we also have a letter from the leader of the program to kind of just connect and really engage. So we're excited to be sending out our second edition at the beginning of 2021. We are also just rolling out our technical assistance offering. This is something that me and our consultant, Michelle Levy, have been working on. We have already had one technical assistance meeting, and we have a couple more scheduled for beginning of 2021. It's our time that we're offering to work one-on-one with organizations and programs across the state to really help integrate our own messaging into their work so that we can have a united language around resilience. And we kind of go through the messaging again with them. Many people have already heard this. We did a convening in August where we brought together, I think, about 160 people from across the state and did a very similar presentation to this. So that's kind of when we first rolled this out to people through a big Zoom gathering. And since then, we're now able to offer that one-on-one technical assistance so that people can feel really confident in utilizing this in all their materials. We also have created a new resource that is housed at Help Me Grow Vermont. This new resource is a huge list. I think it's over 150 of mental health providers from across the state who have specialization and training and awareness of different trauma-informed modalities and family therapy strategies. So that is now held at Help Me Grow, and so anyone accessing Help Me Grow has the ability to now get help connecting to mental health therapists and counselors who might be needing additional support in those areas around trauma and family systems. So we're super excited to continue to develop the resources held at Help Me Grow and make it kind of a one-stop shop for anything that families are needing especially during COVID, which is such a difficult time. All right, and this is the evaluation plan. So after our August convening, we sent out a brief survey to the people who had attended or those who we sent the recording to. And we were really wanting to hear their feedback because this was the first time that they heard our messaging and our theory of change and everything. We wanted to see, is this resonating with Vermonters? Is this something that they're able to connect to? And we were really pleasantly surprised with the results. We had a 20% response rate, which during COVID, I think we'll take it. Everything is a lot more challenging to get engagement and get responses during obviously this difficult time. But from the results, we saw that 77% are satisfied or very satisfied with the integrated messaging work to date. 77% believe that the integrated messaging about the resilience work in Vermont is extremely relevant to them in the organization. 78% said that their understanding of the importance of a shared definition of resilience has improved as a result of the convening, which was really exciting. I mean, frankly, before I started on this project, I never would have fully thought about or realized the impact that a shared messaging platform can have. And it's been a huge eye-opener to me, and I've been really excited to kind of understand the power of messaging. And so it's really great to see that other Vermonters who maybe didn't think about it before are really internalizing that. 46% had already used the shared definition of resilience in their work. This blew me away, the fact that almost 50% of the people who responded to our survey were already using our toolkit, already implementing our messaging into their work. And 96% intend to use the shared definition, and 96% have or will encourage others to adopt the shared definition of resilience. So this was really, really great. And we are doing another round of evaluation in the next couple months where we'll be doing interviews with people that have been involved in the project. So it'll be more qualitative. I think that's it. These are just some of the quotes that our project lead really resonates with. And yeah, does anyone, Janet, do you have anything to add?
No, just wondering if we went through that pretty quick, if you have questions. I will say that our trauma coordinator, resilience and trauma coordinator at the Agency of Human Services has had a huge role in bringing this work forward. And I guess in the beginning I didn't mention, it felt like there was people were in different places around ACEs and screening for ACEs, and kind of more of a deficit, I would say a deficit frame on identifying and looking for trauma and problems versus that more strengths frame. And it would come out at different meetings, and people were talking differently, had different languages. And then when we started this work and really pulled everyone together, we realized that we were much closer in our ideals and our values than the frames that we were coming from allowed us to be. So that this frame, just a very simple frame of using resiliency language, really had so much enthusiasm among participants and people that we interviewed at that big August convening. I think because there was a desire to have a shared understanding of how do we more easily use strengths-based language, and how do we kind of move away from measuring the trauma that people have experienced to changing our systems and our policies so that everyone can thrive no matter what trauma or adversities they have experienced.
I'll also just add briefly to that, Janet. I was on a call last week. I think it was, time's a little weird right now, but with a couple of the people that have been really leaders of resilient work in their own programs prior to the Resilience Messaging Project. And something that just really, I guess I took away from it was Trisha Long, who's part of Lamoille County, their restorative justice program. She was just talking about how resilience is something that we all have and that we all carry with us. And some people have strength in certain areas of resilience and have room to grow in others. And together, if we can all help strengthen each other's resilience as a community, then the whole community is going to thrive through that. And community resilience can help us. We can learn from that and pull from that and strengthen our own resilience. And I think that prior to this project, you saw a lot of these are the resilient people and these are the people that need it. And the resilient people can give their resilience to others, and we all have it within us. And I just thought that was such a beautiful way of looking at it. And it's really stuck with me. And it just aligns really perfectly with the strengths-based approach.
And then we do have a question in the chat about
Sure.
funding.
Yeah, I saw that.
Do you have,
yeah.
Oh, okay.
Sure, I can talk to that. Sure. So this opportunity also came out of at Help Me Grow National Center, we got technical assistance from the Frameworks Institute. And they are the institute that's developed a lot of the shared metaphors that you're all probably familiar with: serve and return, brain architecture, the resiliency scale. What's the other one? So that training about moving away from that deficit-based bootstraps kind of mentality to more of a shared frame. I had that through the Help Me Grow National Center. We brought it back for Vermont and talking a lot about it through my Help Me Grow network partners and at the health department. And so some folks at the health department had some extra funding through the Vermont Public Health Association. Our health department contracts every year with the New England Public Health Training Center. We have some money for different projects. And so they said, why don't you take this really cool framework that you learned from the Frameworks Institute and bring it to Vermont? Because we were trying to use it with Help Me Grow, but bring it to the health department, because the health department had also done a survey the year before on resilient communities. So this resiliency was really like taking off as a buzzword. And so they gave us some funding. It wasn't a lot. So the funding was for the consultant, and then we're paying Emily, I think it's been about $9,000 or something for Emily for some part-time work to kind of help direct this project and the newsletter and pulling all the folks together. So it hasn't been a lot of money. We really need, our consultant says we need 50,000 to take it to that next public health campaign. So looking for some maybe federal grant funding coming down the way. I don't know if we'll use Title V dollars for that, but we're ready now to really expand this. We hope our governor will take it up. Actually, we're working through the secretary's office to share this framework with him. But yeah.
I have a question, and you may have said this and I just may have missed it, but I'm wondering, I know you had put up the slide where there was a lot of different messages and different programs, and I was wondering if there were other factors that contributed to your decision to look at developing a consistent message across the state, and if you have any suggestions for how we in Wisconsin, where we might start, or how we could move forward, with some of the pieces that you have, a toolkit, a newsletter, technical assistance.
Well, first I can share the toolkit, right, Emily? Because we developed that. We're happy to share that, and you can use that. I'm happy to recommend our consultant, and you might try your public health partners, and we could maybe have a meeting or pull Michelle in to kind of share our work if there is a little bit of grant funding somewhere for some technical assistance to get you started. It was really helpful having that neutral, super skilled person. She's worked with banks and health departments across the country, and to really be that neutral convener, because she understands it's much more than just about this language. It's really getting people to come together and to have that shared vision. And that's a skill set. And the other thing is like this 7 C's the 7 C's. It was a different frame. It's not really a strengths-based. There were some initiatives in certain regions of Vermont that at the state level, we did not feel like we're taking in the direction we wanted to go. There's been a lot of focus on screening for ACEs, and we certainly kind of out of the health department and that strengthening families frame, we don't feel like that's really, that tool there's been a lot written about it. There's a great Child Trends article. It has a lot of limitations. It's measuring ACEs, but it's not really measuring your response to the ACEs, which really varies, right? We know that. So there's just a lot of flaws in just screening, and also what's the impact on people when you tell them their ACE score, right? Like, what does that mean? What do you do with that? And then again, just pure confusion that's out there. Just like how many, having dinner together, Askable Adults campaign, everything is regional. It has a different name and so what if we all came together and we just could pool all that energy so it was much more recognizable to people, just to the general public, just to the average guy down the street that's never had kids and doesn't really want to increase spending for taxes of the school system every year. Just how do we really reach a wider, more diverse audience and get everybody to care, business leaders, etc. Emily, do you have anything to add to that question?
I just always think about the Vermont after school example with the third space. And so we have a program in Vermont that is called Vermont After School, and they do a ton of work of what's going on with children and kids and teens when they're, I think it's ages 9 to 26, and it's what's happening when kids are not home and they're not at school. What are they doing? What are they involved in? And how can we take that chunk of time and use it towards positive choices and positive decisions opposed to negative ones? I'm paraphrasing here and probably getting some of this wrong, but so they call that time the third space, when you're not at home and you're not at school, and really like making the most of that third space. And they did a huge messaging campaign of just trying to get the education system and family systems using that language of the third space. And the director of Vermont After School one day was, I don't remember who she was talking to. It might have been the governor, I want to say. Janet, do you remember?
Yeah,
but he used
the governor's office.
Yeah, the governor's office used the language, the third space, and she had never even presented that to the governor's office, but had just come full circle. And then she was hearing their own program's language like back to her. And so that was just kind of like this breakthrough moment of, okay, that's now common language here. We all understand what that means and the impact that that's had. Now we can all identify it, we can all name it as this, and now we can do the work in that space. So I just think that that's such an awesome example of.
Well, and then the governor took it up to give funding for it too. Yeah. So that was the big takeaway.
Exactly. So we're hoping that a similar thing with resilience can happen, and with the resilience messaging work that we've been doing is we hope that that definition just gets fully integrated and absorbed into everyday conversations that are happening with Vermonters around the state.